I'm Linda Parks. I'm the chair of the Ventura County Board of Supervisors. On behalf of my entire board, Supervisor Matt Levere, Supervisor Kelly Long, Supervisor Bob Huber, and Supervisor Carmen Ramirez, I want to welcome you to our January 13th press briefing. Today we are at the Ventura County Fairgrounds, and I am very excited because people are getting vaccinated here. Right now, we have really our healthcare heroes that are getting vaccinated. These are all individuals that actually work with people who have COVID. And this is that first tier that we all hear of, that first phase, and it is happening. And so that makes me incredibly excited. If you would like more information on where you fall in the vaccination lineup, you can go to VenturaCountyRecovers.org. Also, if you would like to volunteer, help vaccinate people and you're qualified, you can also go to that same VenturaCountyRecovers.org and sign up to be a volunteer vaccinator. And I just saw one just a few minutes ago, so it's wonderful to see the community coming together, but most of all, in these really difficult times, how wonderful this is actually that light that we all see at the end of the tunnel, being able to get our community vaccinated. So I am excited. Let me tell you who we have here for you to hear more about COVID as well as our response. Rigoberto Vargas, he's our public health director. He will follow me. Then we have Celta Dubrowski, and she's our infectious disease prevention administrator in our public health department. We also have ER Dr. Rick Rutherford, and he works in our Ventura County Medical Center, and he will give us a status on COVID in our ERs and also with our Santa Paula hospital too. Barry Zimmerman is here. He has been setting up for us all this testing and has helped our county with all the hundreds of thousands of people who have been tested for COVID. He's our chief deputy of our healthcare agencies. So looking forward to hearing from Barry. And then our closer is our wonderful CEO, our county executive officer, Mike Powers. I look forward to hearing about more. Please go and see if you can find information on how to vaccinate at VenturaCountyRecovers.org. And also, if you can or know of others who would like to volunteer, you can volunteer there. Thank you all very much. With that, Rigo Vargas, our public health director. Rigo?
Thank you, Chair Parks. Good afternoon, Ventura County. Rigo Vargas, Public Health Director. So today I'll be sharing with you our latest numbers today and just to offer a few comments at the end. So it should be a brief presentation because we have lots of information to share with you today. So first, you're familiar with this table. It is on VenturaCountyRecovers.org, updated daily, and this is a summary of our numbers. Today's numbers continue to show a very concerning trend, upward trend of our numbers. We continue to report on a daily basis, on average, more than 1,000 cases. So true to that, today we're reporting 1,563 new cases of infection with the virus that causes COVID. When we need to open up businesses and have more students go back to in-person learning, these numbers are really troubling. We need to bring these numbers down. We were showing a flattening of the curve right before Christmas, and we were not averaging over 1,000 cases a day. Numbers associated with testing with the holidays indicate that while Ventura County, you've been so awesome, so great, so strong in emergencies and other situations that we've had in Ventura County, perhaps we collectively let our guard down just a bit too much during the holidays. These numbers that we continue to see, again, there is a direct correlation to the holiday period. So please continue to adhere to the stay-at-home order and to all the guidance that we provided in the past to limit the spread. These numbers are really concerning. Just as concerning our cases and case rate, so is our daily hospitalization numbers. While we are today's numbers are not at the record that we broke yesterday, it is still very high. 440 Ventura County residents are in our hospitals as of this morning. 83 of them are in very critical status. They're in the ICU unit, intensive care unit. And in fact, out of those 83, 44 are even more ill, more serious. They're on ventilators. So while we have still enough ventilators and we have no issues with oxygen in the hospitals, to have 44 out of the 83 Ventura County residents clinging literally to their life is very concerning. Please do it for their family members, for others that are getting infected right now and that might land in our hospitals. Do the right thing of limiting your exposure to this virus by wearing your mask, washing your hands, maintaining your distance, and especially not gathering. Also concerning is our number of individuals that are being reported today as having fallen the ultimate sacrifice to this virus. 16 additional deaths. So we are approaching 400 deaths in Ventura County, and it's clearly a very serious situation when we have this many new deaths reported on a single day. On a positive front, we continue to do very well with a number of new tests. We are reporting just over 9,000 newly Ventura County residents tested. In fact, we continue to, as of this morning, have the best test volume in the state. Ventura County residents, you took our call to get tested. It does help us with tracing and quarantine and overall with flattening the curve if we abide by isolation and quarantine orders once we know our status. And so please continue to get tested. In fact, one of the reasons why our numbers are high is because of the test volume. But it's a good thing. I mean, we need to detect the virus when it's so rampant out in the community. And so, but we can't just let our guard down and get tested and think that it's a free pass if you're negative, or if it's a positive result, that you're not going to protect yourself and those around you. We really need everybody to adhere to all the isolation and quarantine protocols. Our lead public health nurse in response to this epidemic, Salida Dabrowski, will follow me as Supervisor Parks mentioned, and she will give us more information on our current contact investigation and tracing efforts, but it's still very important to get tested. Next, briefly on this slide that is also on our dashboard, it is updated on a weekly basis. This is what we need to continue to look at, because soon enough, and we estimate that the holiday surge will begin to see an improvement in the next anywhere from 10 to 14 days. So within 2 weeks, we fully expect to be over this surge associated with the holidays, and our numbers will improve. And we will get back to the tier system. We will be out of the regional stay-at-home order. And when we do that, then this table will continue to play such an important role so that we can know which additional sectors can open and when more of our students can go back to in-classroom teaching. But related to the number that I reported, over 1,500 new cases today, the weekly metrics that the state provided yesterday for all counties show that concerning continued upward trend in our curve. So you see that we have an adjusted case rate of 73. We need to be at 7. When we need to be at 7 and we're at 73, we know we have a serious challenge in Ventura County to improve our numbers. Again, this is the adjusted number, and it's adjusted very favorably because of our outstanding test volume. Our actual unadjusted case rate went from 71 last week to 131. 131 is our actual 7-day average case rate per 100,000 resident. This is the highest in Southern California, second only to one other Southern California county. This is very concerning. Ventura County, we've always been among the best in the state when it comes to our metrics, but you can see that these numbers are very concerning and we need to bring them down. Our test positivity numbers are also very concerning. As you can see, 17 and a half, 7-day test positivity is a very high number, so we're getting close to 20%. And then in our most impacted low-income, high-density communities, almost 25% of residents from those communities are testing positive. So this is a confirmation that, again, there is very widespread community transmission of this virus, that we need to protect each other, our loved ones, our family members, our businesses and our schools, everyone. We need to do our part so that we can open up more sectors and help each other out, because these numbers are certainly very concerning. The bottom numbers you see in green, they show a better trend, and including our test volume. We still have a good number of ventilators, as I said, on hand, but when 44 people in our hospitals are on ventilators, it's nevertheless a very serious issue. And while we show a positive 3-day average trend in our hospitalization, nevertheless, when we're at almost 450 Ventura County residents in our hospitals getting care for COVID, it is a significant issue. Lastly, just to further demonstrate, again, I think the point has been driven that we're not doing well with our numbers, but we want to be transparent and show you the numbers as they are, so that we can continue to do the right thing of adhering to the public health recommendations that will bring this number down, and so that we could continue to adhere, or even adhere even more strongly and closely to the current regional stay-at-home order. Is this slide? It shows you that at our last surge in the summer, corresponding to July, we had almost 5,000 cases reported that month. In December, almost 25,000 cases. And as of today, we are already almost at 13,000 cases so far this month. We are on a path to breaking that record of 25,000 last month. But all of this could be controlled, can be prevented by our actions, our behaviors, our responsibilities. And so please, I know that everyone has COVID fatigue. Everybody is tired of hearing the message of what will flatten the curve. And while we haven't planned it yet, we will plan it, and these are the ways to do it. And on that note, again, our department continues to do all the work that we need to do in partnership or collaboration with many others in the county family and with city partners. And that does include providing all this testing, providing support for quarantine and isolation, and now with also the vaccinations that are occurring. So for more information on our contact investigation efforts, next I'll call up our lead public health nurse overseeing our response, Salida Dabrowski. Thank you.
My name is Salida Dabrowski, and I'm the Infectious Disease Prevention Administrator for Ventura County Public Health. And I'd like to give you a few updates related to our case investigation process, the new process for reporting business outbreaks, and what to do if you live with someone who has COVID. In December, Public Health began utilizing a virtual assistant tool as part of the state's CalConnect platform for COVID case investigations. It begins with a text to the phone number that you provided at the testing site. This text includes a link to a confidential online survey, just like the one our case investigators have been using when they call you. We really encourage you to please complete that survey. You will also receive isolation instructions, as well as access to any resources that you might need. Additionally, it also helps us to identify contacts to help control the spread of COVID. For those individuals that can't receive text messages, because we realize that there are some, you will still get a phone call from us. This process is allowing us to focus on our high-risk populations and our outbreaks during this surge. Another process that we've recently implemented as a result of AB 685 is our business outbreak reporting process. Any business that identifies 3 or more COVID cases over a 14-day period among their employees must notify Ventura County Public Health within 48 hours. The designated person from that business will find the outbreak reporting form on VenturaCountyRecovers.org under the Business Information tab. You can download and complete the form and email it to us at covidbusiness@ventura.org. And if a business needs assistance with testing due to a large exposure, please let us know via that same email and we will be able to provide assistance to you. In addition, the business information section on the VenturaCountyRecovers.org website has several resources that will provide the necessary information and guidance that you need on testing, notification, cleaning, and employees returning to work. Public Health does not recommend that employers require their employees to provide an isolation clearance letter from Public Health to be able to return to work. We do provide the employee with their information on when they can discontinue isolation. It's also important for employers to let employees that have been exposed know it can take a few days after exposure to test positive, so they need to quarantine for at least 10 days, regardless of receiving a negative test result. Lastly, I want to share some information on what to do if you live with someone who has COVID. I know this information has been shared before, so this is a reminder. It's really important to try to have that person in a separate bedroom with a separate bathroom, if at all possible. If a separate bathroom is not available, it's important to disinfect that bathroom after use and open a window if there is one to increase ventilation. All members of the household should practice really good hand hygiene frequently, not share items like dishes, towels, etc., other common items in the home that might be shared. The person that has COVID should wear a mask anytime they leave their room and should limit contact with others in the household, even pets. Make sure to clean all high-touch surfaces daily, and please adhere to the isolation and quarantine guidance to keep COVID from spreading to the other members of your household. If you need assistance with isolation or quarantine, please give us a call at 805-981-5201 so that we can provide assistance for you. Thank you. Now I'd like to introduce Dr. Rutherford with VCMC's Emergency Department.
My name is Rick Rutherford. I'm an emergency physician at Ventura County Medical Center and Santa Paula Hospital. I appreciate the opportunity to speak with you today. I was asked to provide an update on how the current surge has affected our emergency departments. As you've been hearing, the number of COVID cases in Ventura County continues to be alarming. I worry that sometimes we get lulled into complacency when we hear these statistics day in and day out. But by now, each of us knows somebody who has suffered from COVID. And unfortunately, many of us now know somebody who has suffered long-term effects from COVID, or worse, has even died from the disease. The sustained surge that we're experiencing has put tremendous pressure on our hospitals. We are full. When I walked into my shift yesterday, more than half of our emergency department beds were occupied by patients who needed a hospital bed but were waiting for space to open up. Sometimes we're having to treat patients who are very sick in the triage area, or worse still, outside. This is not ideal. At times, members of our staff are physically, emotionally exhausted. We're caring for a very large number of very sick patients. It's challenging for us to address so much suffering. The surge is going to last for weeks, even if we do everything perfect. But I'm confident we're going to win this fight. Our teams will continue to provide safe and effective care to members of our community for as long as this takes. This is what we're trained to do. I also want to let you know that we are very well supported by the leaders in our hospital, in the healthcare agency, all the way up to the Board of Supervisors. Months ago, we developed a contingency plan in anticipation of this surge. That plan is in effect. By building tents and opening up other spaces in the hospital, we have nearly doubled the bed capacity in our emergency departments. We are currently onboarding 20 disaster relief nurses. We are buying equipment every single day so that the patients in our emergency departments and our hospitals have the equipment they need to get the right care in the right moment. So how can you help us? Wear a mask. Stay 6 feet apart. Wash your hands frequently. Avoid indoor gatherings. It's beautiful outside. If you must gather, please do so safely outside. These are things we hear all the time. I just want to add the perspective that these are scientifically proven acts of kindness. Expression of love for our friends, our family, especially those most vulnerable among us. These are manifestations of the value that we place in living in a safe and healthy community. So how can you help us in the emergency department? First of all, we need you to come at the right time. Obviously, we can't see everybody who has COVID. Shoot, that would overwhelm us. But if you have COVID or you think you have COVID and you're struggling to breathe, we need you to come to the emergency department. We've learned a great deal about how to treat this disease. The death rate is going down. But we have to start those treatments when they can still make a difference. We're also still seeing patients who are afraid to come to the emergency department because they're fearful that they can catch COVID in the ER. I want to assure you that every one of our emergency departments in this county has very sophisticated protocols in place to keep you safe. If you're having concerning symptoms, chest pain, severe abdominal pain, weakness, or other symptoms of a stroke, don't wait. Come in immediately, because the care that we can provide in those first few hours, that is the care that will truly make a difference. I'd like to end by expressing gratitude. I'm so thankful to the scientists and the logistical experts who have allowed me to receive a safe and effective vaccine, and in record time. Soon this will be available to you, and I want to strongly encourage you to get vaccinated. This is our path to normalcy. I also want to express thanks to members of our community who have been adhering to these public health guidelines. I truly believe that it's this adherence that has prevented our hospitals from being completely overwhelmed. So thank you. And with that, I'd like to introduce Barry Zimmerman, our Deputy Director of the Healthcare Agency.
Thank you for that information, Dr. Rutherford. Very valuable that we stay safe. I have two items that I'll cover today. One, I'll do a testing update, and then I'll get into the process and some more about the vaccination rollout plan. First of all, testing, it continues to be a priority. All our existing testing locations are operational and are absorbing the demand that we are receiving right now. Many people are seeking testing, and we continue to encourage that. We've improved the throughput on many of our testing locations, in which the wait times are down significantly from the weeks preceding the holidays of the new year. So I encourage you to go to our website at VenturaCountyRecovers.org, and it lists out our testing options there, the time, wait times, and so forth. In addition to that, we'll announce that on the 17th, an additional testing location will be opened up in the East County, and that will be at the Conejo School District fields there off of Jans Road. And that will be an OptumServe site that will be run by state staff in cooperation with the county to service our residents. In addition, another site under the same jurisdiction and activity will be opened in Oxnard at the Blackstock School in Oxnard, and that will open on the 24th of this month. Both of those sites will be pre-registration sites. Also, they are working with the school districts in which they are being hosted by to put priority on teachers and those in the school environments that may receive testing. So please contact your districts, as well as look at our website, in which that information will be linked up shortly in the week when those sites will open. So I'll move now to the vaccination process and where we are today. As you can see, we are here in our vaccination center at the fairgrounds. It is one of several sites, and more sites are being planned at this point and to be rolled out in the weeks to come. We have a location at South Oxnard that is a drive-through pod environment, and that's at the Centerpoint Mall, as well as this location, as well as we have a dedicated site now operating for first responders and critical care individuals are there by invitation, and those that are eligible to receive vaccinations. In addition, we have at Public Health at their location servicing special populations and so forth at that on an invitation basis to manage that flow. To complement the county system, we are going to be looking at opening a site in East County. We are doing the facility check this week, and hopefully next week early we will have that and announce that site as an option as well. Our strategy is to secure a few more locations, some that are larger even than this fairground location, in order to set up even more capacity throughout our community. To complement this infrastructure, we are also working with pharmacies throughout the county in order that they can qualify to be distribution sites. We have 10 pharmacies from the Vaughn's store chain, as well as 3 in the Ralph's network, that have just been certified, if you will, or approved to become distribution sites. And so we will be working with them to get vaccines so they can open up and be scheduled for appointments as well. All appointments will be managed through a link on the county web page. That's at the VenturaCountyRecovers.org under the immunization section, where you can find information how to register for a vaccination site. As you can imagine, the demand has been high, and we are in our first phase of the rollout at this point in time. So far, we started Monday with nearly 500, yesterday over 600 individuals, and today will be just under 1,000 individuals vaccinated, and that is our goal, is to continue to grow that capacity. So I would like to go over just a little bit who is eligible and who is not eligible to receive the vaccine at this phase of the rollout. Be mindful that our capacity to roll out and to vaccinate individuals is based on our ability to receive vaccines from the state. That is a huge undertaking and a huge distribution activity, but we are only giving so many allotted doses per week. At this time, we're averaging under 10,000 doses a week. And so that really consumes all the access points that we have today. We are working with the state to increase that so we can also increase our capacity and serve more individuals. Covering those who are eligible for the vaccines, we are in what's known as Phase 1A right now, and that is focused on the healthcare industry. We have an extensive list on our webpage that identifies the industries and the type of occupations that fall under that healthcare umbrella. And those have been our priority. We have already completed our vaccination efforts through the hospital systems and other urgent care systems, as well as the skilled nursing facilities throughout the community. We only have a few of those left to finalize with this first round. That has been very successful, and we've vaccinated more than, as of my numbers I received yesterday, more than 15,000 individuals in that first effort. As we continue with Phase 1A, which is the healthcare workers and like occupations, we estimate that there's about 35 to 40,000 individuals in that total population who are eligible to be vaccinated. So we have reached out to them and asked them to register for an appointment. At this point, we only are offering appointments relative to the number of vaccines we have received. So if there is not an appointment available, that would come based on a weekly basis as we receive our vaccinations. Phase 1A is healthcare focused. Phase 1B then changes to a different segment and population. Many have read a priority to shift seniors, and I would classify them as 65 and older, 64 and older, up in the priority standing. The governor is making that as a priority order for us to serve a larger number of the senior population. But I want to be clear that we are moving them up in priority, but they're still in Phase 1B, which is our next phase to go into. We're still in Phase 1A. When we get to Phase 1B, we will be dealing with the senior population as well as essential workers. And the essential workers are those on the front line. And so it would be grocery workers, agricultural workers, law enforcement, and so forth are in that tier with the seniors. That is the next phase that we'll be going into as soon as we complete Phase 1A. As I reported in the board meeting the other day, we will do our best due diligence to work through Phase 1A as quick as possible. We don't have to be completely done with that phase in order to open up into Phase 1B, but we're not there at this point in time. That is coming, and I anticipate that in the next couple of weeks that we will be in Phase 1B. I know it can be confusing because there's a lot of levels to the rollout. So we're trying to communicate as best as we can. We would encourage you to go to the website that I referenced earlier, and there is a section on there to subscribe to vaccination information. Please do so. We send out daily notices on that to keep you apprised of all the activities that are occurring with vaccinations at this point in time. So that kind of concludes my remarks at this time related to vaccines and our process. Our goal is, though, to increase our capacity, which we are actively doing in order to serve as many people as we can in this vital time to receive your vaccines. I will now turn the time over to Mr. Powers, the CEO for the County of Ventura.
Thank you, and good afternoon, Ventura County. It's very exciting to be here at the fairgrounds today to see shots going in arms. This is what we need, and this is what's happening, especially when we hear the high numbers of cases in our community and the high numbers of cases in our hospital. Mr. Vargas referenced the fact that Ventura County now has the highest per capita test rate in the state, and that's remarkable, and that is a credit to our wonderful community, all of you heeding the call to action and getting tested and stopping the spread. But it's also a reflection of the capacity. And I think that's one of the reasons we wanted to highlight it too, is we want to reassure you that we are building capacity and we will have the capacity to administer the vaccines as we get them from the state. As Mr. Zimmerman said, that's our primary limiting factor right now, is frankly getting the vaccines from the state. We will continue to advocate regularly around the clock. Dr. Levin does regularly, saying, please, if you get us the vaccines, we will get us administered. And you can see our rate for administration is one of the highest in the state. We also want you to know that, as we said before too, it is truly all hands on deck. Whatever resources are needed, we're marshaling all the resources that we need. And the task force knows, the vaccine task force knows, if they need funding, staffing, equipment, whatever it is, they got it. Go big. Don't be afraid to ask, no matter how big the request is. And they are asking, and we're giving it to them, and we need that. You can see it in other ways too. We have over 300 Ventura County employees reassigned as disaster service workers. Many of them are here today. Our public works agency leadership is in fact here today helping to administer this clinic. Many of our county physicians are actually here helping to administer the vaccines as well. And that's one of the areas where we do continue to need additional assistance is with vaccinators. And so we're excited that on that very same website that Mr. Zimmerman referenced, VenturaCountyRecovers.org, people can register to sign up to become vaccinators. And that's really important. And so we just did that a couple of days ago. We've already had over 450 folks from our community sign up, doctors and nurses and paramedics and EMTs and so forth, sign up to become vaccinators. That's huge, hugely helpful, and it's something that we greatly need. So the community's coming together. We will have capacity to provide the vaccines as the state rolls them out. And just thank you all you're doing, Ventura County, to keep our community safe. Thank you and take care.
Testing 1, 2, 3. Testing.